your home now.
Window Works of Chattanooga, Chattanooga's local family-owned window company.
Every month we enjoy welcoming Dr. Shawn Jones from Chattanooga Wellness on the show. This morning we're joining him over at his office in Chattanooga, where he's showing us about a laser he uses to help patients with neuropathy. Good to see you this morning, Shawn.
Hey, it's great to see you also. Thank you for being on with us, Julie.
So you say that neuropathy is a real concern for a lot of folks in this area.
Yeah, it's a big concern. The three main causes, it used to be diabetes, that's number 3 cause. The number 1 cause is chemotherapy. You beat cancer, now you got neuropathy. Second most common cause is surgery, low back or knee surgery or neck surgery or wrist surgery, and you can develop neuropathy in the hands or feet. And of course, diabetes is the third most common cause. And the symptoms usually are pain, numbness, tingling, burning, itching, balance issues as it gets worse. That's the kind of things you feel. This is Lexi, our sleep coordinator for sleep apnea studies that we do in the office too. Go and lay down for me, Lexi, if you don't mind. She's going to be our patient today. Let's put you on your tummy. Nice down. And so we're going to do treatment now. When we do the laser treatment, that's just part of what we do. So she's going to get started on her feet. But what we do is you have to treat the origin and the termination of the nerve, not just the feet. Don't just remember the feet's the problem. You also have to treat the low back. So we're working on her low back here today as well, treating that. Oh, hang on, I need a pair of goggles. While the laser is running, you have to have safety goggles on, and she's face down, so she won't need them. Oh, you look beautiful, Julie.
Okay, so you're using, you said, the laser on her feet. Is that always, Shawn? Because what if you have issues in your arm? Do you still have to?
Yeah, in the arm's the same thing. We're going to treat the neck and then the wrists and hands for hand neuropathy. If it's feet, we're going to treat the low back, but from the fourth lumbar down through the S2 nerves right here, everything that goes down to the lower feet and lower legs. So we're going to treat the origin and the insertion, the termination of the nerve at the bottom on the hands and feet. And by doing that, we get much better results. We have a 98% success rate if you're suffering from neuropathy. And this is just part of it. You're seeing the laser. Carrie, it's my wife, Carrie, she's doing laser treatment right now on Lexi. And Lexi, you feel the warmth yet?
Yes.
Yeah, you just feel warm, soothing. There's no pain. There's no downtime. And we get tremendous results from people.
When you talk about things like an 80% success rate, is that something, Shawn, that is permanent, or does this require repeat visits?
Well, it's actually 98% success rate. But some people need to do maintenance visits. Once they come in and do the program, the rest of their life, they can come in. If they want a little tune-up, they can come in for just $60 and get a tune-up the rest of their life. It's a great deal for them. And so some people come in once a month, once every 2 weeks. Some people don't need to come in. It depends on the person. It tends to be diabetics tend to have those sugar issues. If they start sugar binging, they start having symptoms creep back. Now, what the type of program we do in the office, we do laser treatment. We do chiropractic care, at least on the feet. We may do the spine also, depending on their surgical history. And then we also do vibration therapy and massage care, where it squeezes and massages the feet and the calves. We do all that every time they come into the office for in-office treatment. If they have more than 50% sensory loss, they're going to require some home treatment. So we actually give them equipment that they own that they'll have the rest of their lives, which is red light therapy. They wrap their feet in, and what's called a rebuilder. A rebuilder helps to re-educate the nerves to function again. Because the problem with neuropathy is, as it progresses, you start to get balance issues, and you start to stumble and fall. And if you're having problems like that, there's no need to suffer. We want to get your balance back. That's why we get you on vibration therapy when you're in the office here to help coordinate balance and your proprioception, as well as doing the massage chair, and of course the chiropractic care where I adjust the feet bones or the wrist and hand bones, and of course the spine if the patient is able to get that.
We're down to about 2 minutes left, Shawn. What's the background on this laser? What's the studies that have been done on it? How long has it been used?
There's lots of, it's been around since 1973, and they found more and more applications. Now, I'm glad you asked it. There's 4 things that every laser does, whether it's like a 3-watt laser like I have in my pocket here, or this laser here. So like this is my little 3-watt handheld laser. And I put that on to reset muscle strength on people. And so what we do is the laser is going to decrease your pain. You're going to feel a decrease in pain. It's going to increase blood flow. It's going to decrease swelling. Whereas heat, if you put heat on your back or your feet, it's going to increase swelling and decrease blood flow. But laser will increase the blood flow, decrease swelling. And the 4th thing that's amazing is it's going to speed tissue healing. The mitochondria of the cells are your powerhouses. When laser hits those cells, it exponentially does a Krebs cycle. It kicks out ATP, That's why my twin brother, remember Dr. Mark, that's why his nerves in his hand, when he cut his hand all the way like this, fell through some glass, in 10 days, he was able to move his fingers, where the surgeon told him would be 5 months. You think he said all the surgery patients in here. He did a cast, and he was able to move his fingers in just 10 days.
I'm down to 45 seconds, so I want to make sure people have a way to write down your phone number and get in touch with you. Is the website the best way?
Remember, $49 to come in and get your first laser treatment and the full evaluation. You see how severe it is for $49. You can't beat it at Chattanooga Wellness Centers in Cleveland or Chattanooga.
All right, the website is laserawaypain.com. There you can see 2 locations in Chattanooga. The number is 643-2277. If you're up in Cleveland, you'll find them at 790-5000. Thanks, Shawn.
Thank you, Julie.
James, your car was pulling to the right, and you came to Budget Brake seeking alignment. What happened?
They fixed it for the best price in town.
His path was crooked.